outside the West Midlands, that will be of significantly less interest. The film was a quick 8-minute journey through the headlights in terms of sector-led improvement in the West Midlands. I think the key exam question that we all face when the regulatory framework ceased, and in fact this goes all the way back to Peter Hayes' presidency when we started on the sector-led journey, is can the sector be trusted to effectively judge itself? Now that is an exam question that will continue to be posed, whatever form and methodology we use going forwards. But what we've tried to do as we've gone is continually evolve. And if the last 14 months isn't an example of why you need to adapt what you're doing, I can't think of anything else that would be. So we did a couple of years back introduce at the start of the process case file auditing, so that we would have principal social workers from across the region coming and looking at practice, forming judgments about individual assessments, and then using that to form key lines of inquiry. We have recently moved on to a confirm and challenge approach that's designed to support councils through the COVID pandemic, to help them start thinking about recovery, to help them start thinking about relationships across the system, resilience in the care sector and with the voluntary sector, and particularly start thinking through some of the issues that carers have been facing through the lockdown period. We have also introduced experts by experience, which is why Mr. Mansell is here with us today to talk through later on the contribution that he made to bringing his perspective. So it is a methodology that is constantly evolving. Now we're looking at the dial moving back towards a more regulatory approach. What we wanted to do in getting the University of Birmingham to look at the work that we've been doing across the region, and indeed we've got 5 further challenges that are penciled in this year, was to give us that objective view and try to start answering that exam question of, is this robust? Is this objective enough? Does it lead to tangible change? Is it sufficiently challenging in approach? And I think just before I hand over to Professor Robin Miller to talk through the key findings from the work that they're doing, the key benefit of all of this from my perspective is that you've got people who understand the context for local government, you've got people who understand what it is to experience the services that we offer and that we commission, and you've also got a political read here. So by triangulating those 3 strands alongside looking at frontline practice, all of those things come together to give a much quicker and frankly much cheaper view than other sources of independent view may do. Now I'm hearing promises in the chat that we have a video that's about to work. So this is either going to be 4th time lucky or it's going to be a spectacular pie in the face. But Robin, if you can hold fire for a minute, we'll just see if we can get that clip to now work.
Can I just say, I've just done a, can you hear me? Can I just say, can you hear me, Matt?
Yes, I can hear you, John.
I've just had a message from Clinton Farquharson saying that he's been waiting for ages to be let in, and he's not been let in.
Okay, we'll take a look at that. Let's just see if we can get the video up and running.
Okay.
Okay.
Within the white paper, it's clear that a new regulation framework will be introduced for social care. It is likely to contain information about market risks and also issues around how cost runs from local authority to providers and to the workforce. As a region, we've already put some work into thinking about how we might prepare and develop our approach. We think our data hub and networks and peer challenge experience puts us in a good position. We think there is much for CQC and DHSE to learn from about how we self-manage, how we drive sector-led improvement in the region that they can use and draw from to develop their national approach.
West Midlands ADASS has an active programme of peer challenge, so every local authority undergoes a peer challenge once every 3 years. We explore the full range of issues relevant to adult social care.
I think we've gone through something like 3 cycles of each of the 14 local authorities. A team will come in led by a really experienced director who oversees the coordination, the actual peer review process. They will then gather a team of people around, including lead politicians, experts by experience who are users of and carers of people who use services, other senior managers and leaders within systems. And I think because it's people you know, but also people that have different experiences than you and good credibility, you take a lot of cognizance of that. People who've got lived experience are much more able, much more intensely, acutely aware of what are the things that go wrong, what are the things I would want to know if I was going to be a recipient of care in the system. And they ask the most poignant questions. And we use those really in a very kind of powerful feedback way. We use quotations from people. So it's very direct experience that gets fed back. It gets shared initially with the council. The council will use that in a wide range of engagement and stakeholder forums with politicians, with staff, with stakeholders, with members of the public. But we then, as a group of directors of social care, will also share the learning of that. So it's really powerful because it's about taking the things that we know evidence-based practice shows are having good outcomes for the citizens of those areas, and we share and learn from that and also build on the things that haven't gone quite so well.
The networks have been a key feature of the improvement programme for a number of years. Those networks include external partners, people like Skills for Care, University of Birmingham. We also engage extensively with NHS partners in the region and partners from Public Health and Department of Health and Social Care, really to make sure that we've got that focus on strategic issues at a system level.
We have a very active regional commissioning network. Lead commissioners share good practice in terms of quality and costs. And that gives us a really good insight about what's happening over the region. It's really helpful as an individual local authority to understand where you are in the pack, whether we're paying too much or not enough. It helps us to understand where we are quality-wise in terms of the proportion of providers rated good or excellent by the CQC. And I think over the last few years, that comparative benchmarking has enabled us to drive up quality and get more cost-effective.
The way we use our resources network in the region really forces us to ask some hard questions of ourselves and each other about what we're doing with the money, how we're using it to support people, the outcomes it delivers in a way that we wouldn't be able to do if we weren't so well organised through West Midlands ADASS.
The networks that we have through ADASS and the professional reports and the sharing of information that we have is really important in making sure we understand, have we got a particular gap in a certain part of the profession? We undertake lots of lobbying and engagement with national and regional colleagues, particularly in the NHS, to demonstrate the productivity and the financial gain of having a sustainable workforce.
This is a shared web-based resource. The intention is that we use that data to get a really rich picture of what's going on in the West Midlands. That data does exist publicly, of course. However, it's spread across lots and lots of different locations and can be, frankly, a real pain actually to find.
The data hub's really important for us. So it provides in one place a number of key metrics around social care, activity and performance. It gives a really quick view about how we're performing, what areas of weakness we might have, and importantly, which areas might be doing better than Coventry, which can then lead to a phone call or conversations about what they're doing. It's really useful to spot any trends as they emerge, which means we can intervene and act earlier. In relation to the care market, we can see what risks might be starting to emerge in providers, staff turnover and vacancies, again, as a key indicator of risk.
Data about hospital admissions and discharges, being able to compare how we're doing on those discharge pathways, which are both important to people, but also politically pretty hot potatoes.
And then we've got some of the pandemic-related important metrics that will put us in that should put us in a good place to deal with whatever the future of regulation looks like for social care.
One of the things the West Midlands has done is to take sector-led improvement seriously, introducing a regional programme of peer review. It's not just the process of being, if you like, looked at by a peer review, it's also the process as a member of the team yourself, looking at another council, actually your own learning of being involved in going somewhere else, talking to other people, thinking, oh, I like that, I'll borrow that, I'll use that. So it's a shared basis for that. And also, I think an important element of that was to introduce actually looking at the recording and the experience of people who were receiving care. How is all of the ambition of the authority being translated into work with the lives of people? Ultimately, this is all about the knowledge and experience that people have of living in communities and choosing to live the life they want to lead. And I think the real progress is about really hearing and understanding that experience. So for all the data, all the research, it's also about voice. And I think also what I've seen is a big shift towards thinking local and beginning to really understand the complexities of living communities and how sometimes it requires the gentlest of interventions and support to allow communities to flourish. I think it's really important that the restart of external validation of performance isn't a sort of Miss Havisham moment and freeze the clock. Because as I said, I think that that external offer should always build on a really strong sense of self-improvement. Knowing yourself and knowing your own journey of improvement should always be stronger than that can always be found by an external view. It's always helpful to have a fresh pair of eyes. External validation can add something to it, but it should always build upon that sense of your own journey and your own improvement.
Okay, well done, Precious, for managing to get it to work. Welcome, Mr. Farquharson. Apologies that you got held up on the way there. Thanks for joining us. And no less than the president-elect himself in the room. So over to you, Robin. If you could go through the findings of the research, that'd be excellent. Thank you.
Okay, thanks very much. Good, and hopefully you can all hear me okay. So my name is Robin Miller. I'm Professor of Collaborative Learning at the University of Birmingham. And I'm going to be speaking on behalf of the research team, which includes my colleagues Sharanya Makesh from the Department of Social Work and Social Care and Jason Lowther from the Institute of Local Government Studies. And I'll be talking about the recent evaluation we've done of the peer challenge process within the West Midlands region. And as a university, we were very keen to undertake this work, partly because it's a very important endeavour for ADASS and a local practice community. And we are very committed to doing research that's useful to what the current and future practice is. It's also a very under-researched approach, and despite the fact that sector-led improvement has been so important to local government in general and adult social care in particular, when we undertook an evidence review, we could only find 12 peer-reviewed papers alongside grey literature. Which highlights really how under-researched it is. And that's true in healthcare as well. We've done some work around special measures in hospitals where peer improvement was a part of that programme, but again, it's not been well studied. And finally, we think there's an area for considerable further research, both in comparison to other improvement or assurance approaches, such as consultancy and national inspections, and also in relation to other peer review processes, because as we know, it's often not so much what you do, but how you do it. In terms of the study, we'll produce some slides that will be shared after today, and the report will be available by the end of May. We undertook a literature review, we undertook interviews with key participants from different stakeholder groups, and we undertook a survey as well. So we're going to draw on all those findings in terms of what we're going to share today. So there's two main elements we wanted to look upon. First of all was what's the value? What are the benefits of doing this peer challenge process, which is so embedded in the West Midlands adult social care approach? And in terms of our research, we found that 78% of people, so the vast majority of people, thought the peer challenge was extremely or very useful to improving adult social care in their local authorities. And a similar statistic, which I think is interesting, is 92.5% of people thought it was a good use of resources, which I think, again, highlights that people feel that it's a very effective way in terms of trying to understand what's going well and what can be improved in adult social care. And we asked them to compare the peer challenge process in relation to other improvement approaches, and it was generally rated much better or somewhat better than inspection and consultancy. And 88% of people said they would definitely recommend the peer challenge process to colleagues in other regions as a way of improving adult social care. So what were some of the benefits that people identified? Well, the first thing is they said that rather than just take a kind of headline view of key metrics, it went much, much deeper. It looked into the culture of their organisations. It looked into the key dynamics between different parts of the local authority and external stakeholders, in particular communities. And it tried to look at the leadership and gave them important insights into how the organisation was being led and overseen. It was also been a regular opportunity for the local authority to stand back and to reflect upon what are we doing well, what are we finding challenging, and how are we progressing with our strategic plans. And all of us recognise that's an important part of what we do day to day, but unless we've got a structured approach to doing that, it's very easy for that to slip off the agenda. Interestingly, didn't say that the peer challenge would always say something new, that actually sometimes what was really helpful was it confirmed some of their suspicions, their assumptions about what wasn't going so well and perhaps what they could change. They also often added some important nuance to that. So people would have a partial picture, but actually the peer challenge process added some very important detail and some very important context to that. And it also supported, in terms of some of the initial thoughts of a DASS or principal social worker, it sometimes confirmed those, and therefore that was helpful in terms of speaking to the wider local authority and saying, look, it's not just us saying this, but actually some trusted external partners are also confirming that view. And what was often a result of the peer challenge process was it would then lead to either a new or revised action plans by the DASS or the principal social worker. And alongside the benefits for the recipient authority, what we heard time and time again was there was huge benefits for the people who were involved in the reviewing team. And the reviewing team had people with lived experience, obviously had an experienced director of adult social services, principal social workers, and very importantly, I think this process is it had elected members from other authorities. And some of the highlights that people shared in terms of benefits for the reviewing team were, first of all, they could learn from the recipient authority. So whilst each local authority is different, there are a number of similar challenges that they're facing. And actually going into another authority, having the time and the access to find out what they've been doing in terms of some of these shared challenges often led to then the reviewing team taking back those ideas and building upon them in terms of what they were doing in their authority. Sometimes for the reviewing team, it confirmed that actually what they were doing was quite good, and that was reassuring that actually the track they were on was a good one to follow. And it was particularly beneficial, I think, in many ways for the elected members. And if we try and think about people who take on the elected member roles, often, first of all, it can be people who don't necessarily come from an adult social care background per se. So this is a really good opportunity to meet colleagues within the review team and to spend time going in depth in another authority. It can also help the elected members to connect up with colleagues who do similar portfolio briefs in other local authorities, which they saw as being very helpful. For principal social worker, there was an opportunity to engage at a more of a strategic level in terms of their work. And for people with lived experience, it really helped them to feel valued, that they were part of this quite illustrious review team, and they were being listened to by very senior members of the recipient local authority, which they saw as giving them sort of individual confidence, but also in terms of confirming the importance of their views. And the reason people said that the process did work well was because the way that ADASS, working with the member local authorities in the West Midlands, had set it up. And there's got to be a acknowledgement to the work of Helen Coombs in this regard, who's really led a lot of the process. And they both facilitated the individual reviews, They provided training, which was seen as very valuable to the reviewing team members, and also provided helpful tips, advice and guidance to both the recipient authority and to the review teams. And that led to over 90% of people feeling that they were individually well prepared or better to either receive or to lead a review. And a similar number who reported that actually the recipient local authorities were very well prepared in terms of the review process. As one would expect, some of the issues that came up in terms of the process were just the logistics, the practicalities of engaging these different stakeholders, of making sure they got a robust timetable in place and that they got the necessary resources to administrate and to support the review team. And the review team, and the fact this was interdisciplinary, was seen as absolutely central. So to have that view of the review DASSs, the practice view of the principal social workers, lived experience, and elected members bringing a political perspective was seen as being absolutely key. And the skill of the person who was leading that team was an important enabler to delivering in practice. And the practice review, which you heard about on the film, which was something that's grown in strength as the peer challenge process has been developed in West Midlands, was a really important element. And within that, you've got two external principal social workers sitting with the host principal social worker to look at strength-based practice in that local authority, and also the practice conditions that we know are vital to foster the delivery of strength-based practice. And the practice review team look at case records, they speak to senior leaders, but they also crucially speak to team managers and social workers. And the insights from that practice review are very important insight for the peer challenge as a whole. So what we found was, in summary, was a very positive experience and something that people saw was generally beneficial and provided a good value for money. But it wasn't perfect, and nothing is perfect. And two of the areas that came up in particular that could be improved, and West Midlands ADASS are responded to this very seriously, is first of all, it was great to people with lived experience as part of the review team, but there's an opportunity to do that better. And some of the comments we did get back from people with lived experience was at times they were unsure of the boundaries. What were they allowed to comment on, and what was outside what was expected of them? And also at times perhaps a lack of confidence that they perhaps had the skills and expertise in order to meet that expectation. There were still some examples of people using jargon or assuming an underpinning knowledge that they perhaps did not have. And as I said earlier, the way the review team was run was absolutely crucial to them feeling that they could contribute and participate as fully as they would like. And in terms of others and other people's views of people's lived experience, it was a similar thing. And actually one of the things that came up was perhaps more training for the other members of the review team in terms of meaningful involvement of people with lived experience. And again, this is quite typical, I think. It's a major step forward, an important step forward for us to have people with lived experience as a central part of this process, but we need to understand how we can do better and to build upon the support we provide them. And the other major area for improvement, I think, was the extent to which the learning from each individual peer review or peer challenge process was shared with the wider region. And what we found was a pretty consistent message that 50% agreed there was a wider learning for the region, but 45% of people were unsure. And I think the unsure bit is just they weren't unsure about how that relates to the practice in other organisations. And similarly, but similar numbers were unsure if it actually had been shared in practice. And there has been some processes put in place in terms of the principal social worker network in the region, in terms of some annual events, particularly in the early days of Peer Challenge, to share the lessons. But I think it did highlight that that's an area that we could do more on in the region in terms of making sure we get the most value that we can from the peer evaluation process. So in summary, I think it's fair to say this is a well-established process that is providing an important contribution to improving adult social care in the region. And I think there's some implications that can be taken forward in terms of the current national review for insurance improvement. The first thing is that the nature of the process enables it to be challenging. People said they were generally challenged and it wasn't always a comfortable experience. but it was also a supportive one. And recipient authorities said that they felt very able to be open about what they were doing as well as what they weren't doing so well as part of the process. The issue about the kind of practice reviews and the social work, the principal social workers being involved in that suggests that perhaps we could do more than just look at principal social work roles in that. We could also look at a wider professional group such as occupational therapy. The regional focus of the peer challenge process has been important because it's helped to build local networks in the region. And it's also meant that the reviews are contextually relevant. So yes, each local authority in the West Midlands is different, but there's also a commonality between them, and that's been important. West Midlands ADASS has provided, I think, effective leadership and coordination, and it's also just championed the importance of this process with new DASSs and new elected members when they've come in, and that's always important to do. And finally, this point about lived experience. It was valued by all. It was seen as an important contribution, but equally there's more to do to understand what is required to enable people to feel confident and supported in contributing as much as they could do to undertaking these review processes. So hopefully that gives you a kind of a rough kind of insight or a quick insight into what we found in terms of the research, and we will be sharing, as I said, a more detailed PowerPoint and indeed the report by the end of May. So now what we're going to do is we're going to have a panel discussion, and we're going to start off with stakeholders from the region who've been involved in the peer challenge process, just responding to the findings of the research. So we did send it out to them earlier so they could get time to think about how they want to respond to this. So for that, we've got Matt Boucher, we've got Paulette Hamilton, we've got Richard Harling, and we've also got John Mansell, who's one of our contributors with lived experience. So John, do you want to just say hello, because you've not met the rest of the panel yet today?
Hello. I'll just see with.
Great. Do you want to give a bit of your background, John? You've gone on mute. Okay, that's good.
Good. It's always delays on the screen, yeah. Hello, my name's John Mansell. I'm also known as ex-booze hound. I'm a mentally ill retired alcoholic. And since I had my mental breakdown in 2013, I've done as much as I can, possibly locally and more widely, to help other people air their views and experiences with mental illness and addiction. I might as well get it in there. I'm also an author as well, so I have a book out there available. I was very fortunate, and I was very honoured to be asked to take part in the peer review. And I think at the time, it was said that Matt Boucher had taken a gamble in asking me to be part of it. I was described as a guinea pig, as I was the first person to be a expert by experience, or as I prefer to call, a life experience warrior. And I have to admit, initially, I was quite nervous about the whole situation. Having said that, listening to what Robin just said, with regard to there were things that could be done better or done more deeply with lived experience or expert by experience. One of the things he said was about being unsure of boundaries. And if I'm entirely honest, I was never bothered by the boundaries. I wasn't unsure of them. I wasn't bothered by them. And the reason I wasn't bothered by them is because I'm there to be who I am. I'm not there to be a well-behaved member of you know, the establishment. I'm there to be me, and I think that's it, looking at the going further forward with the lived experience people. That to me would be a message to get into their minds, that they've been asked to be part of it for a reason, and the reason will be some stuff that they've done before. The reason will be, you know, that the people around, like Matt Boucher and other people, respect their point of view, and they're there. And if there is a lack of confidence, just to remember that they're there to be who they are, because that's all you can be. You know, it was great to see the process, and I thought it was really worthwhile and, you know, quite eye-opening. But it was really important that I was just me and nothing else. And I definitely thought it was a well worked setup, and I was really proud to be part of it.
Great, thanks, John. That's great. That's great to hear. It was such a positive experience for you. Thank you. So, Paulette, do you want to come in next? So, in terms of the research, did it mirror your experiences? Was there things that surprised you, or things that you expected to see included within it?
I've got to be honest, Robin. I've known you for a long time, and no, the research didn't surprise me. This method has helped people like myself. Why is Clinton laughing? Sorry, I know Clinton really well. This research, for people like myself, who, when I first came in, for those who don't know me, I started my life as a nurse and have no understanding of social care. So I had the pleasure of doing my first peer challenge with Ellen and Peter A when he was in Birmingham, and it was daunting. I'll say that it was absolutely daunting, but I learned so much from that challenge that it's built on from there. And what has happened now with the networks that have now been set up, and I'm chairing one of the networks, what we've been able to do with what you've done, Robin, we've been able to, as elected members, been able to really add value to what's going on. So it's really helped us as elected members to know what we're looking for, to know how to work with senior officers that perhaps we don't know, how the questions to ask when we get into a peer challenge. But the thing I learned from when I did it with Peter A many years ago, Peter was so diplomatic with how he fed back, because some authorities, you have to be really careful. It's not that they don't want to hear. We're all a big family, but it's how you actually feed back. So over the years, I have really learned how to hit that message in a way that people grow from it. So can I say, Robin, nothing you've said in the report surprises me, but you know what's good? It's in one place. So we can now use it as a learning tool going forward. So I think well done and an excellent piece of work.
Thanks, Paulette. And I would confirm nobody gives a harder message in a nicer way than you. Matt, so what was there's two main things we saw for improvement. One was the experience, the people's lived experience, and one was the sharing of learning around the region. So maybe do you want to have a reflection on that? Was that sort of disappointment, or was that something you expected us to find?
I think it's fair. Firstly, I think the barriers in terms of getting involved are much more significant if you're the person with lived experience. And I think, you know, there's a job to do there to build confidence, to make sure that we've got more training opportunities available, as you've suggested. I think we've got to think about how we adapt the methodology a bit to make certainly some of the information more accessible than it is, and acronyms would be chief amongst that in terms of crimes committed by officers. But I welcome that. I think we need to scale it up, and we also need to think about the role of health watches locally, so that we've got that network of network things. So wherever possible, you've got as broad a range of local voices that you can tap into as possible. Secondly, there's one of your recommendations is about the level of depth that the challenges go into, and also making sure that the scope is sufficiently broad. And I think as a region, we need to put maximum time and effort into getting the scope right in the first place. Mm-hmm. I, as a host director, might have a list of things I'd love you to see, but chances are they're going to be a bit shiny. They're going to be at the more impressive and better performing end of the spectrum. So I think we need to be really transparent and challenge ourselves to be a bit more warts and all, perhaps. And I think the point made about benchmarking is equally fair. There's got to be comparability, not standardization, but there does have to be a meaningful means to be able to compare. And then finally, I think the point about learning is particularly interesting given COVID. So the clock starts ticking the minute that the challenge is concluded, and the currency of those recommendations, which, by the way, could do with being more specific and a bit more challenging in some instances, doesn't last very long. So if we are going to leave a benefit across the region, we need to move fast and we need to communicate effectively. But I do think, in terms of the positives, we tend to get the right people with the right skill set and the right expertise on the right challenges. And that's one of the benefits of the peer kind of approach. So I think it's fair, I think it's balanced, and I can see plenty of opportunities to take positive steps forward to make this more robust.
Thanks, Matt. That's really helpful. And I should say to the audience in general, if you've got any queries or questions or comments, just write them in the chat and we'll share that with the panel. Richard Harling, what do you think the lessons are from the peer challenge process and the research to date that should be thought about in terms of the national review?
So I think the first thing is this point about culture, and that's a point that ADASS has been trying to make through the Department of Health and Social Care. The right culture is one that seeks to reflect and learn and improve rather than judge and punish. That doesn't mean that it can't be challenging, but it does mean that local authorities can be open and honest about their strengths and their shortcomings. Everybody does something well. Nobody does everything well, and we should all be looking to continually improve in everything we do. I think the second thing is that there's a number of components to our peer challenge program. So using data, self-assessment, the actual peer challenge meetings themselves, and they are consistent with the emerging ADASS view about how adult social care assurance ought to work. So I think that does give us quite a strong foundation to build on.
Okay, thanks, Richard. That's really helpful. And John, a similar question to you then. So we're having this national review of quality improvement and assurance. Building on your kind of experiences in undertaking the review in Dudley, what would you say to the kind of national review team then that needs to be the lessons that you would share with them?
That's a good one, really. I think I am unmuted, aren't I?
Yeah, loud and clear.
I think for me, it's important that we get more people like myself involved in that process, and partly the reason being is I think people like myself from outside the system, we're not as tied back as the people within the system. Obviously, they have to be aware of the politics, they have to be aware of certain things, and they have to be and they're aware of what they can and can't sort of pick into. Whereas I think sort of with and although Matt said earlier, with regard to all the acronyms and all these sort of things, I did a little vlog after I took part in the peer review, and I stated within that quite a lot of the time I didn't really know exactly what was going on, because I didn't know the different departments, and I didn't know the hierarchy and the things. But that didn't matter, because I think for me the most important thing in anything like this, whether it be NHS, whether it be adult social care, is whether it be the patient or the people that are giving the services, it's got to be about the people. And if the people aren't right, then it doesn't matter what system they're in, it's not going to work. So I think what someone like myself or other lived experience people brings to it is, it's not, I'm not saying that all you guys are inhuman, but it brings more of a human aspect to it, and I think it's really important that is taken forward, that allows us to know that we're making a difference. So I've been in lots of different situations where they talk about, co-production and listening to their users and things like that. Well, they talk about it a lot, but not very many organisations actually seem to put the money where their mouth is. Whereas what I saw with Dudley, Matt Boucher taking the risk and asking me in, and what I saw with West Midlands ADASS working with Helen and Pete, is that they were willing to listen. They were willing to ask what they wanted of me, but also they were willing to try and implement things and look at things from a different point of view. And since doing the peer review, I have been included in a number of conversations, and so moving forward, I think ADASS as a general rule, they will get an awful lot from making sure that every peer review challenge has some lived experience on that peer review, because we bring a different aspect, we bring a different angle, and it's really important. And also I think hopefully what I've tried to do as well, and I will do later, is say this, on Twitter and things like that you guys are listening to what I'm saying, and you guys are interested in my point of view as well, and it's not, I'm not just there as a token. It works, and it really does, and hopefully that answers the question.
It does. No, thanks, John. And I think it's ironic that for some of the people with lived experience, almost they felt they couldn't contribute or they couldn't be taken seriously because they didn't know the language and the acronyms. But actually, other people said, well, the fact they don't know these acronyms and they just tell it straight and they tell it as they see it was actually one of the most powerful contributions they made.
Yeah, absolutely. And I think I said during the conversation with your researchers, and they asked me how much preparation did I put into it. I had to be honest, and I said I decided not to put too much preparation into it because I didn't want to preempt what I was going to find. I'm never, as an outsider, I'm never going to understand the full workings of adult social care. So why try? Just go there and be who you are and respond. They do say it's fail. Was it fail to prepare, prepare to fail? I prefer to wing it, and I think it works better that way because it's more honest. Hopefully that answers that question.
It does. No, thanks, John. That's right. That's right. The benefits of winging it. I think that's what you were saying there. So, Matt, do you want to respond to the question that Carol said, which is very, very interesting about financial viability?
Yes. So Carol, I'm going to describe this as a Columbo question. So thank you very much for raising it. So the question, just so everybody's aware, we know the Secretary of State will be empowered to intervene if a council's found to be failing in its duties. And the focus today from government in determining intervention seems to be on safety and dignity, financial viability, and a council's ability to improve at the pace needed. Any reflections on the viability issue from your experience of peer reviews? I think you've got to bear in mind now that for about 11 successive financial years, with the exception of things like the recent COVID-related grants and the Better Care Fund, the net resourcing for local government and adult social care is circa 40% of the typical share of a council's budget, has not increased in line with demand or in real terms, and in most areas has in fact decreased. So I think that any central focus needs to have a robust methodology for understanding, firstly, sufficiency of resource. We know that the thorny issue of long-term reform has been punted down the line through successive governments on both sides, so I can say that during PERDA, and that the recent white paper doesn't really answer any of those questions. So I think when you look at those councils who have been very close to municipal bankruptcy, the starting question has to be, is there actually enough resource in the system to do the job properly? And I'm yet to see a methodology that has been adopted across the board that answers that question. I think there are then beneath that a whole raft of perfectly sensible questions that you can ask about use of resources that some of the benchmarking data that our finance network regularly looks at. It is fair, and I think you don't just look at unit costs, you look at staffing infrastructure, but you also look at processes and pathways, and you look at self-directed support, you look at direct payments, and what you try and do is form a judgment about whether or not the resources that do exist are being used proportionately, are being used in a person-centered way, enable quality in terms of care and support, and whether or not there are any obvious consequences that can be, or conclusions that can be reached about doing better with that cash. But the headline message has to be set in that context. So if you're going to come and judge a service that's had demand up year on year for the last 11 years and resource down, do not be surprised if you do see issues that link to resourcing, and the entirety of your conclusion should not purely be about that framework that is not set by local government, it is set centrally, and it's reflected in terms of the policy on the day.
Thanks, Matt. That's really helpful. Paulette, have you got you obviously have a great overview of resources in Birmingham City Council. Have you got any perspective to share on that financial viability issue?
Just quickly, as we're in PERDA, I've got to not be political, but as a cabinet member and as somebody that chairs the Health and Wellbeing Board, there just isn't enough money in the system. In Birmingham, we've been unique through a lot of the work, the changes in practice, through using 3 conversations, really moving towards a preventative type model, using neighbourhood networks. We've been able to save money over the last few years, but that won't go on because many of the people that we've managed to keep out of the service for a number of years, as time goes on, it doesn't mean they're not going to come into the service. It just means they're coming into the service further down the line. So I've been a great advocate, and what I've been saying and asking of the government, we need to look at a spending review around social care. But we also need to look at how will social care be run in the future. And this is where I think the peer challenges are so important, because there are a number of different things that are going on in authorities that sometimes they're not really publicized. And when you go in and you see what's happening and you see what the experts that are in place are saying, and this thing about the place model and working in the place direction, how do you move money from the health service so you're working with ICSs? There's so many questions up in the air, but for me the fundamental question is, and I have to agree with Matt, there isn't enough money in the system, but a lot of the system is so disjointed that at the moment we seem to be the recipients of the money that we just pay out the other end. So for me, I need to see a fundamental overhaul of adult social care so we can see a long-term future that's sustainable going in the 21st century. And at the moment, I have to agree, Better Care Fund's been keeping us going. Even some of the joint work we've been doing with the NHS, it's using Better Care Fund money. Many organisations will tell you with the Better Care Fund money, if you put $1 million in, you expect to get $1 million out. You know, so it's very much they're working to the budgets that they've actually put in there. So it does need to change a lot. As a system leader, it hasn't been easy over the last 6 years, but we've had to really tighten our belts. We've gone from a position of, I think it was 13% on direct payments to nearly 40% on direct payments. So we had to really look at how we manage care and services within Birmingham. But for me, the long-term issue is how are we working with the NHS to look at that prevention piece? And this is where the ICS and working at a system level where we don't duplicate is going to be so important. And I'll stop there.
And that is a fantastic end note. Thank you so much to the panel, to Matt, to John and Paulette, for providing such an informative discussion on the research and the peer evaluation process. And it's just over to Richard then for some final words from the West Midlands.
Thank you, Robin. I hope it's come across that in the West Midlands, we believe we've got a strong foundation of peer challenge that we can build on as adult social care assurance develops nationally. In the spirit of continual improvement, we've asked Robin and colleagues to review the programme. We are very grateful, Robin, for your insights, which we will use to refine and enhance the programme over the coming year. And we hope that our experience is helpful for colleagues outside the region, and very happy to share more details with anybody who is interested. Thank you.
I'm not sure whether we're going to get kicked out, but I think Matt's got his hands up. I don't know if Matt wants to say a final word, and then we'll probably close down.
Very quickly then, thank you all for your time and for joining in. We didn't get as much time for questions as we'd hoped because of the technical issues, so I'll pop contact details in the chat if anybody's got anything they want to raise, and thanks to all my colleagues for their contributions today as well.
Thanks, everybody.
Thanks. Bye.
Good session, Pete. Thank you for inviting me. I really enjoyed that.
Hi, Margaret. I didn't see you. How are you? You there? Yeah. Hi. I thought we might be kicked out at 5 o'clock, but it sounds like you can carry on, Margaret, if you want to say hello. And
no,
I think
Matt's
still there. Yeah.
You're looking very smart, Mr. Bowsher. You just dressed?
Good girl. How are you?
I'm fine, thank you.
Has one rebadged by deed, Paul? Are you Lyndon from this point forwards, or?
I know every day he says to me, "Why don't you apply for a blue badge? Just a temporary one." But I won't. I'll just go for the sympathy vote.
Oh, fantastic.
Oh, it's good. I can do a couple of steps across the kitchen now, so I'm about the consultant reckons I'm about 4 months ahead of my progress, so I'm quite pleased with that.
Excellent.
I'm a resilient old bag, you know.
You got to be. You're a DASS.
Used to be.
Yeah.
Well done, John. That was brilliant.
No, absolutely, John. Fantastic.
I've just realised, by the way, the session's still being recorded. So some of the things I'm going to say to you, John, I'll probably do a bit later on, mate.
I think we're all right. Yeah.
I just wanted to say I thoroughly enjoyed that. I enjoyed the exchange. John, I thought what you said, your contribution was absolutely brilliant. And this is, as far as I understand things, exactly what we need from experts by experience. So to hear you say that yourself was just fantastic for me. Thank you.
Yeah.
At the moment, by the way.
Anyway, on that happy note, I am going to leave you guys to chat. Okay, thanks a lot.
Cheers, Shelley.
Cheers. Bye.
Yeah. So apart from the video, Matt, and thanks for your smoothing that over. We rehearsed it 4 times with ADASS Central, but it obviously didn't quite land with them. But there we go.
I'm slightly mindful that they might not be able to edit the video down, Pete. So I'm going to be slightly guarded in my comments. That there were one or two people that were struggling to get on the call, including Clinton, and I'm not sure why that was, but we'll have to make.
Clinton I think Clinton had the wrong link, so he sorted.
Oh, did he? Right.
Yeah. But I don't know whether you want to. We can set up a meeting next door, Matt, if you want a quick chat.
Yeah, John, did you have more feedback that you wanted to chuck in as well?
I don't seem to be able to unmute.
You're unmuted. You're fine.
Oh, am I? Oh, right. Okay.
I'll set up a meeting and I'll invite you both.
Okay.
Fine.
See you in a bit.
Yeah.
Bye.